I'm sure most of you are facing some level of irritation in your thoracic region, and that's precisely the point of discussion today. While the governments engage in blame game, it's time for us citizens to take charge of our own health. We will be shedding some light on the profound health concerns and the effects that the airborne pollutants and these harmful gases are having on our body.
Stay informed. Monitoring AQI is your first line of defense. Use apps and websites for real-time data. Adjust your outdoor activities based on the air quality. Plan accordingly on poor air quality days. Use air purifiers. Invest in a quality air purifier for your home to improve indoor air quality. Ensure it can handle pollutants commonly found in Delhi's air. Wear masks. On days with poor air quality, consider N95 or N99 masks for your outdoor activities. Masks filter fine particulate matter and harmful gases, crucial for commuting or exercising. Limit your outdoor activities. Protect children and the elderly by limiting outdoor exposure on several compromised air quality days. Postpone your outdoor exercises or opt for indoor activities majorly. Indoor plants. Certain indoor plants naturally filter pollutants. Consider snake plants, peace lilies, and spider plants to improve the indoor air quality. Diet and hydration. A healthy diet rich in antioxidants, vitamins, and minerals can strengthen your immune system. Stay hydrated to help your body flush out the toxins. Regular exercise. Exercise is crucial for overall health, but do it during hours when pollution levels are lower. Indoor workouts are a safer alternative on poor air quality days.
In our recent conversation with an expert, we addressed some of the most frequently asked questions on Google related to air pollution. From understanding the causes to how to get a solution for your health, we've got you covered. Let's dive in.
Absolutely. There is comprehensive evidence worldwide to show that exposure to these toxins, which include PM 2.5, PM5, PM10, nitric oxide, sulfur dioxide, what we call as SOx and NOx, volatile hydrogen compounds, and other carcinogens, increase the incidence not only of asthma, but upper airway allergies, wheezing, chronic obstructive lung disease, and a host of other infections in the upper and lower respiratory tract. Yes, indeed, a well-fitting N95 mask, I again repeat, it should be of a particular specification, will significantly decrease the exposure, especially in the vulnerables and small children. Remember, children have a lower lung capacity and lower reserve air volume, and they breathe at a faster rate than adults, so they inhale more amount of gases per minute in terms of volume. So a well-fitting N95 mask will distinctly help. I think the basic advice from a medical angle point of view is please do not self-medicate at home. Do not rely on any alternative therapy or any WhatsApp messages which circulate around. Don't use any herbal medicines of unknown nature. Do not use antibiotics on your own, and don't use painkillers in combinations on your own. When do you see a doctor? Any cough which is dry or hacking for more than 24 to 48 hours, please show a doctor. If your saturation at home, especially for the elderly, is dipping, I think it needs medical attention. Any cough with vomiting, fever, breathlessness, the three cardinal signs, consult your doctor immediately. So headaches are of different nature or of different types in different age groups. But if it's a mild headache, which is not very severe, it's not pulsatile, and especially in the elderlies, if your blood pressure is well controlled, I think you can take a simple paracetamol if required. But any headache which is pulsatile, which is severe, which is retroorbital, which is closer towards the eyes, or if it is associated with other comorbidities, instead of self-medicating, take a consultation with your doctor. So AQI is when the entire city is a gas chamber would have limited effect because the amount of time which you're just cordoned in one room will be that much limited. There is bound to be exposure outside the room and outside the house. So I think it has limited value, but especially in children who are asthmatic or wheezers or who had immediate past history of respiratory involvement, air purifier may help a little bit because the smaller kids will be in the room for at least 8 to 10 hours, especially at night time. Yeah, so I think in all age groups, exercise, what it does is it increases your basic metabolic rate. It makes you breathe faster. It's an excess load on your cardiorespiratory system. And with the external environment, which is so polluted, it will put a much extra and added and much unwanted strain on your heart and on your lungs. So it's best avoided. Wait for the environment to clean a little bit. Dipping temperatures, smog which settles early mornings, or early morning walkers can be dangerous. Again, there is overwhelming evidence that pregnancies are impacted with this kind of pollution. The nitric oxide, the sulfur dioxides, the carbon monoxides, and the particulate matter do impact the fetus and the pregnancies. Children can be born, in fact, fetuses ultimately can be born with structural abnormalities and chromosomal damage. So I think it's important that pregnant women, especially in the first and the second trimester, do not expose themselves. The only indication really should be in this kind of toxic environment. To go out is only when you're seeking medical attention or going to your gynecologist. So I think we need to make sure that the toddlers would require some amount of activity. Try to keep them early morning and late evenings indoors. But if there is any spell of some sunshine and a little bit cleaner environment, do take them out into an open area. Try to avoid very closed, clustered, crowded places, market areas where they can probably get cross infection. Make sure that the children's immunization is adequate and up to date, and just keep to simple protocols as far as managing small children is concerned. Please do not jump into over medication, especially with the mild cough. Look out for warning signs of vomiting, respiratory distress, or not being able to feed adequately, or lethargy. Consult your local pediatrician immediately.
Well, like you heard, according to the experts, prevention is the only key. So stay informed, stay safe, and take care of your health in these challenging times. We'll keep coming back to you with more health related information soon. But till then, mask up, Jai Hind.